Welcome back to Island Life Live. Dr. Paul Norio Morton is a renowned orthopedic surgeon, also known as the Robot Doc, for his expertise in robotic-assisted knee and hip replacement surgery.
You know, he was named a top doctor in 2024 and 2025, but since we've seen him last, he's been really busy doing some new and exciting things. Here to tell us all about it is the Robot Doc himself, Dr. Paul Norio Morton. Aloha, Dr. Paul.
Hi, how's it going?
And you brought a friend. We got, this is Bryson Naito, a physical therapist. Aloha, brother. How are you?
Hi, good.
Welcome to the show.
Yeah.
Hi, thank you. Thank you.
And welcome back, Dr. Morton. We're so happy to hear that, that you're doing great, that you've been super busy, and that you're expanding your practice and even have a new name that's super catchy. Tell us all about it.
So we expanded our practice recently, and we now have changed the name to Pacific Bone and Joint. Or PB&J for short.
Hey,
I love that.
that
Easy.
works.
Easy for remember.
And so now we're trying to cover orthopedics, broad spectrum of orthopedics, and continue to do great care for hips and knees. And we also are bringing in physical therapy as part of the clinic and try to really kind of capture everybody coming in underneath the umbrella and make sure that we really take care of everybody as they come in.
I love that. Just like a one-stop shop.
That's the plan.
Handle all of our issues with our knees and our hips. And of course, Bryson, you are a physical therapist. So I wanted to ask you: is physical therapy like a one-type-fits-all kind of thing? Is there a treatment plan that can be used for most people?
So not really. So patients and people, they're individualized and they're unique. So that means that they need specific, unique treatment plans. And so the one good thing that we can do is we can see people in their homes and whatnot, and talk to them as people. Really get down to the nitty and gritty of why they need help. Right? Everyone has pain, and everyone can't do certain things, but it's really figuring out what they can't do, and that's my job, is to facilitate them into achieving that goal.
I like that. So it's not like a cookie cutter plan. You're
Sure.
actually working with the clients to figure out what best fits them.
Right. And that's the one cool thing about Dr. Morton and his practice, is that I get to work so closely with his team and kind of really just kind of see and capture them as a person. So I get to see them immediately after surgery. If they decide to be seen in their home, then I could see them in their house for a few weeks and then transition them into our outpatient clinic.
And I know that you folks also have a lot of good hands-on stuff that happens before surgery, or maybe even work that can be done to avoid surgery. Isn't that right, Dr. Morton?
100%.
Yeah?
So I think physical therapy is a great modality in order to treat some people's pain. I've definitely had a lot of patients come in with knee pain, and we try physical therapy and successfully treat it. I've even signed up people for prehab, doing physical therapy before their knee replacement, and turns out they actually got better, and call back and counsel and say, we don't want to do surgery at this point. My knee feels fine. To me, I say, that's great. You feel good. Let us know if we need to change anything.
That's beautiful. I love that. You really are wanting to take care of your customers from your clients rather, from the very beginning to the end. And one-stop shop, exactly like what Dave said.
Prehab. Wow, I learned something new
Prehab.
today. Awesome.
Absolutely.
I think you should coin that. It's his. Nobody else uses it. It's his. Now, Dr. Morton, how can people reach out to Pacific Bone and Joint, or PB&J, and the physical therapy? How can they connect with the clinic?
So we have a website, pacificboneandjoint.com. So just log on, and you can call us 808-439-6201.
All right, and we have all the information up on our screen there. You have 2 locations, right?
One in Cuneo and one in town at the Ala Moana Medical Building.
Very cool. And then Bryson telling us we can do home visits as well before transitioning them back to the office.
Absolutely.
That's awesome. Well, hey, thank you. This is the first time on TV, Bryson.
Oh, he's so good. Okay, now you can checkmate me right here, sir. Nah, just kidding.
You get plenty of problems.
You know who to call.
All right, thanks, Dr. Paul Morton and Bryson. Thank you so much for coming in. All right, again, today is Martin Luther King Day. It's the Martin Luther King Jr. Day holiday. It's also National DJ Day, and that's the subject of our Yuso Akamai question. How many hours did the longest DJ set last? 2, 4, 24, or 244? That seems like a lot. 244?
Seems excessive, but could that be the answer?
Yeah, we'll get you the answer coming up after the break, along with You Gotta Hear This.